Welcome to Age Well, Washington County. I'm your host, Andy Wallace, Behavioral Health Specialist with Washington County and the Oregon Older Adult Behavioral Health Initiative. Thanks for joining us. I recently had the opportunity to talk with my colleague, Kera Magarill, Older Adult Behavioral Health Specialist with Washington County Disability, Aging, and Veteran Services. Kera and I talk about her work in supporting healthy aging here in Washington County. We discuss the importance of social connection and the power of positive age beliefs. We also hear from participants involved with Age Cafe, a program promoting conversation and social connection at the Beaverton City Library. Let's hear from Kera and our friends at Age Cafe. Kera, welcome. Thank you for joining me today. I'm really excited to talk with you. It seems to me that some of your favorite work is around social connection and connecting people in the community, especially when it's an opportunity to talk about aging and related ideas. Could you tell us about Age Cafe?
Yeah. So to talk a little bit about the importance of social connection, we know that loneliness and isolation is a big component that impacts our health outcomes, especially later in life, and it disproportionately impacts older people. So that's a big focus area. We know that if we can address that loneliness and isolation and create more community, a sense of belonging, more connection, it actually helps us with improving our health outcomes throughout the lifespan. So we actually, in Washington County, we work, the Older Adult Behavioral Health Initiative works with aging services and behavioral health and public health through our Community Health Improvement Plan. And we have a committee that exists just to address those issues of loneliness and isolation in the community. So, so we know it's an issue that we want to address, especially with this population.
Sure.
Age Cafe is a great way to address loneliness and isolation. It is basically small group conversations in a community setting. Anybody can show up. We meet oftentimes monthly on a regular schedule, and we invite people of all ages, but it's mostly attended by older adults, to just have conversations about their experience with aging, with life, with growing, with learning, with gaining perspective. So we talk about a variety of topics that are important, that matter. And what we find, the feedback that we get from our participants is that there's not a lot of opportunity to discuss those meaningful topics. You know, even with family or friends, sometimes you're just sharing the news of the day and you're giving a report, but really to just have an hour of time to talk about what you know about gratitude, or what you know about intergenerational connection, or your thoughts, feelings, fears about the future. Those are really interesting, meaningful conversations that bring people together with skilled facilitators bringing out those discussions from our participants. Another thing that our participants say is that sometimes because they might tend to be a little bit more isolated. Maybe they are not going to work or don't have a regular schedule that they have to attend to, or maybe their kids have moved out or moved to a different part of the country, or maybe they don't have a spouse, they've lost their spouse, or just a variety of reasons that put them in a situation that might be more socially isolated. Something like the Age Cafe invites people to come together, meet their community, meet their neighbors, have interesting conversations. And some people say this is the first people that they've talked to for the whole day was coming to the Age Cafe. So we know it's important on that practical level, but it also reaches some deeper meaning as well.
Where do those happen in our community?
So we've held our Age Cafes in a variety of spaces. Our the partner that we work with mostly is our library system here in Washington County. So Beaverton City Library has been a really fantastic, welcoming host for our Age Cafes. We actually partnered with Beaverton City Library and Viva Village, through our work with Washington County, and that group of 3 partners helped develop our first Age Cafes. From there, we've trained other libraries, we've trained faith communities, we've had them at our culturally specific community partners, and really throughout Oregon. We received a grant last year to bring the Age Cafe to a variety of other partners. So it can happen wherever in a variety of places. It all started at the library, but it's really spread from there.
Well, it brings people together and fosters a sense of belongingness. We don't want people to feel alone. We want them to feel part of the community. And in doing that, it kind of prevents the sense of like isolation or loneliness. People can come and feel heard, feel seen, and that really promotes healthy aging.
I met some people. There's some great people who come here and want to have conversations that are important to me, about topics that are important to me, and let me express myself and to learn from them. So that's really kind of feeds my heart and my mind.
I've gotten more perspectives, different perspectives from people. And the thing that I see probably the most is the wisdom of aging people. I have my own perspectives, and I see that other people bring so much more wisdom, and I can learn from that wisdom. So that's enticing for me. I'm excited to get older to gain that wisdom.
So I think one of the stereotypes of aging is that older people are a homogenous group, that they're kind of the same. But what we find at Age Cafe is that people are so diverse, and that's really exciting. So people are sharing their unique experiences, their personal stories, and it shows that there's no one way to age and no one way to be an older adult, and it really breaks those stereotypes about it.
I guess to accept people and not be too judgmental. To make friends, you have to be kind of open, other views and other stuff. So that's what I have learned from Age Cafe.
It just gets better. It just gets better. And the fact that we can work together and be together like we were today, and all the barriers seem to go away. Working together with people, good things happen. And it happens and it grows with more people. And that's why I'm so teary today. It's because it feels like we're just recognizing that.
Well, I've actually participated in a few of those Age Cafes at the Beaverton City Library. And one thing that I took away from that is people go through the cafe, and I think they come through that experience and have a more positive view of aging. Another area of your work that I'm a huge fan of is your work around positive age belief. I'm wondering if you could talk about positive age belief, but maybe let's start with talking about ageism, its evil cousin.
Yeah, we'll definitely get to positive age belief, but if we're talking about ageism, ageism is pervasive in our culture, really now more than ever. And it's oftentimes described as one of the last socially acceptable stigmas. And sometimes it's invisible in its nature. We don't even realize that it's happening. And we certainly don't really realize the negative consequences and outcomes that impact all of us. We are all aging. We all have people in our lives that we care about that are older. And we want to thrive throughout the lifespan in our communities. And sometimes we don't realize how ageism impacts that for us. So if we're going to define ageism, it is the prejudice, stigma, and discrimination that is experienced. Really, it can be experienced by people of all ages, but we know that ageism disproportionately negatively impacts us as we age. So older adults are going to be disproportionately impacted. Although ageism we can experience it no matter what age we are. There are 3 types of ageism to really understand more about. First is interpersonal ageism, and this was actually brought up when we did our interviews after the Age Cafe with our Age Cafe participants. This just how we treat one another based on nothing other than someone's age or perceived age. So if I were to tell you, wow, Andy, you look really great for your age, that might sound like a compliment, and you might even receive it as a compliment.
Sure.
But really what's happening is that statement reinforces the negative viewpoint, perspectives of aging, and tells the person that there is a preference for youth, for being young. And so it just reinforces that ageism. Another example of interpersonal ageism is maybe when somebody is having a birthday, and you might give them a card that says, oh, getting over the hill, or something like that, just a negative, or like skull and crossbones or something like that. And again, it's sort of meant in jest, but you would never send a card like that for any other marginalized community. It would be quite jarring to see something like that so casually just out there. So that's a concern, because we dismiss those as like, oh, it's just all in fun, but it does have impacts, certainly. Another component of ageism that we don't always, it's kind of, we don't always see it very clearly, but it's happening, and this one is most concerning. We have to talk about it because it does have really negative impacts, which is systemic ageism. Things that are part of our systems, maybe our communities on that level, our health systems, how we are showing up in workplaces, in our families. So that kind of systemic impact. And the way that we might see this is maybe an older adult that is pushed out of their career due to the fact that they're getting older. Or maybe an older person that is trying to apply for a job, and their application is kind of dismissed, or they're pushed to the bottom of the pile because of their age. A way that we can see the systemic ageism in healthcare settings is sometimes, as an older adult, if I came to my care provider and described a set of symptoms, maybe I have concerns about my memory, or maybe I'm experiencing pain, or maybe my range of motion is changing. My healthcare provider, if they dismiss or minimize my symptoms, or just say, oh, that's just because you're getting older, then that leads to actual health consequences, because we're not addressing my health needs, and that can make things worse when they could have been addressed earlier. So we like to, this is kind of the conversations that we have when we do our trainings with professionals, to understand how to recognize symptoms and what's appropriate ways to treat older adult symptoms and issues. And then we also like to encourage our families and individuals in the community to understand how they can advocate for themselves so that they can have not just longer lifespans, but also longer health spans too.
So tell me about positive age belief.
Yeah.
Let's talk about the inverse there.
Yeah. So positive age belief is kind of what it sounds like, thinking positively about aging, especially your own personal aging journey. And that's what we call internal aging. So there is also internal ageism, where we think negatively about ourselves. We think, oh, I feel so old, or oh, I'm too old for that. But that's where we can really address ageism very directly, is how we feel about ourselves. And we can do that through positive age beliefs. Positive age beliefs, there's been a lot of research by Dr. Becca Levy. And what she's discovered in the past couple of years is that people who have positive age beliefs live on average 7.5 years longer than people who don't. So this was a longitudinal study of many, many different people. And when we think better about ourselves and aging, some magical thing is happening where we might tend to be better advocates of our own health. We might tend to have better social connections in the community. We might take better care of ourselves and our bodies because we really care about it, because we like living, we like aging. So that's positive age beliefs can actually have those real measurable impacts that we like to see when we talk about healthy aging.
What I noticed is that there is a difference between being 60 and being 82. And so that aging is a growth process just like all the rest of our life.
I believe that as we get older, as a rule, we don't get more conservative, we don't get stodgier, we don't get, we get, if we're healthy on the right path, we get more the way we really are.
Our society thinks that our external matters, and it really doesn't. I think internally, it's where it's at. And so the makeup and the clothes and the finances and all of that, it really doesn't matter. It really is who you are in your heart, and I would like to have more people know that.
I remember my wife when she turned 70 and someone said, "Oh, you look so good as a 70-year-old." And she said, "This is what 70 looks like." This is what 70-year-olds are doing. And I think that message needs to get out there.
I think society and we ourselves will limit ourselves with what's appropriate at the age. Blame on both sides. We comply with what society tells us, and society tells us you're limited because you're older.
Time is available. Time is all you got. If you're trying to rush through things, you're going to lose more than you're going to gain. And I think we're killing ourselves trying to rush through things. And I would tell my 20-year-old self, slow down. You've got time. That's all you've got.
I didn't expect to be lived this long. And now I would say, you have to just be yourself, and you don't know how long you have in this planet. So just do best you can.
So how can older adults, and I think I've heard this happen at an age cafe, how can they better advocate for themselves and kind of push back against the messages, the ageist messages that are so prevalent in the greeting card aisle and other media outlets?
Yeah.
Yeah, tell us
Well,
about that.
at this point, we've been doing the Age Cafe for about 6 years. So over that amount of time, we have really wonderful advocates, participants that are coming to the Age Cafe to talk about what's important to them as they age and their experiences, both positive and negative. That's something that I think people get wrong when we say positive aging or positive age beliefs. They think, oh, everything has to be rose-colored glasses and that everything's good. And that's not really the case. What we want people to walk away with is a diverse view of aging. That's really powerful, because oftentimes when we see aging represented in the media or in news stories, or maybe even those of us that work in the aging field, oftentimes we're working with the most vulnerable people. That's how we internalize negative stereotypes of aging. But what we want to try to do is really broaden our viewpoint to get a diverse view of aging. And that's what we do at Age Cafe, is that we ask open-ended questions. Everyone gets a chance to tell their stories, to talk about their perspectives, their beliefs, and we have lots of people that are really great advocates and lots of people that have different challenges and struggles, and they can just be very real, open, in a non-judgmental space, and I think that that's really, really important, is to just feel the full breadth of what it means to be growing older.
Yeah, I've certainly experienced that at Age Cafe. There is real conversation. Yes, my knee hurts when I get out of bed in the morning, but I'm so thankful and I'm
Yeah.
so grateful. There's this idea that people get sad and bitter as they age, and research shows that that's really not the case.
I know that's something that's such a hard stigma to shake, and even when I'm out in the community with older adults and I hear it in the stories they tell me, but when I tell them that there's something called the happiness U-curve, which is basically over the lifespan, we see that people are report greater well-being and happiness when we're very young, and then it kind of dips down. It looks just like a U-curve, and then it shoots way up towards the end of life. And sometimes that's really hard for people to really start to let sink in, because these messages of being sad or depressed are, again, so pervasive. But that's not representative of what we actually see. Older age is actually a time of great growth and reflection and wisdom. What older adults, what I see and throughout my career and every age cafe, is that really they don't sweat the small stuff. They know for themselves what is important largely, and what's not important. And maybe it's a sense of limited time left on their journeys, is where that perspective comes from. Also a lifetime of figuring things out. So I really feel really lucky in the work that I do. I think that when I go to Age Cafe, wow, I get to wake up and go and do this, and hear these stories from people. And I'm trying to, I want to soak it all in and just take it, and if I could bottle it and give it to other people, that would be my dream. But I think that's what we've done with trying to replicate programs like the Age Cafe throughout Oregon, to try and do just that, because it really just takes the time of being with diverse older adults in our own communities, and that's what's going to help address ageism and this negative view of aging.
Anything I didn't ask you that you'd like to share with us?
If people are curious about how they could learn more about shifting their own maybe negative age beliefs, or maybe just understanding how you believe, what your beliefs are about aging, you can learn. There's lots of resources to do that at the Beaverton City Library, where we hold our age cafes. We have an age positive reading list that people can go and request or find online. And one of the books that we often direct people to is Breaking the Age Code by Dr. Becca Levy.
Great
you
book.
can find out about how to bust all the myths of aging, that again, sometimes you might not even be aware that, oh, that is a myth, and figure out why it is a myth. And then also Dr. Becca Levy talks about her research with positive age beliefs, and she has a method, she calls it the ABC method, on how we can start to address some of those negative age beliefs and start to shift our view of aging into something that's more positive and healthy.
Well, Kara, thank you for being here today. Your work is amazing, and you have such a positive impact on our community. So thanks so much for being here with us.
Thank you, Andy.